Welcome to Medically Speaking. Our guest today is Lisa Greisler, President of the Visiting Nursing Association, Western New York. Lisa, thanks for joining us today.
It's my pleasure. Thanks for having me.
So I want to talk a little bit about the VNA itself, but also your career path and your passion for nursing, in particular home care nursing. So if you can, let's start overall. Tell us a little bit about the VNA, who you are and what you guys do here in the Western New York community.
Sure, great. So the VNA is the oldest home care agency of its kind. It was founded here in Buffalo in 1885, really as an opportunity for a Sunday school teacher who was able to afford to have a nurse take care of her at home. And she realized what a great program that would be for others. And so she started a charity, and here we are today, now covering 10 counties across Western New York and serving over 5,000 patients on any given day.
I mean, in looking back, it seems like that decision to create a home care business was way ahead of its time. More and more patients seemingly are getting care in their home, getting discharged from hospitals or surgeries sooner to be able to, to be treated or to be cared for in their own home.
Yeah, for sure. It really is. It's one of the legs of the health system stool, if you will. Really supporting the hospitals, nursing homes, physicians in the community, and having the opportunity to provide services for patients in their home setting where many things can now be managed quite well and to free up the hospitals and other sites for really more critical patients.
Obviously, key to that is the personnel that are in the home working with patients. Let's talk about your career. You grew up in the VNA, so to speak. Tell us about your background and your career path.
Sure. I went to school at UB School of Nursing, and I spent the first a couple years in a hospital setting. And then I had a friend who worked with me, and she went to the VNA, and I followed her. And I never left. And what I found was that it really was a chance to do the type of nursing that I think all nurses really want to do. It's truly holistic nursing. You're caring for the whole patient, and you get to see how they are dealing with all of the factors in their life and how those things really impact their ability to be well and to stay at home. Really, people want to be cared for at home when they can, and I think that's the most important thing that we're able to do for our patients.
And when you began your career and you got into that home care setting, obviously much different than being in the hospital. What was the light that went off, or what was the passion that you found when you knew, aha, this is it, this is something I want to do and this is where I want to be? What was that for you?
A big part of it is the one-on-one care that you get to have with someone in their home. You really get to see the whole picture. So instead of a snippet of time in a hospital room, you are seeing the entirety of that patient and their family and what's impacting them. So you really get to practice holistic nursing, the art part of nursing, as well as the clinical part. I mean, as you mentioned, our patients are a lot sicker and more complex than they were, decades ago. And so we're providing care for patients from, newborn infants to the very elderly and a wide variety of conditions and, infusion therapy and ventilators and wound care, you name it. There's all sorts of care that we're able to provide for patients in the home care setting now.
So we talked about how you essentially grew up in the VNA, or you spent your majority of your career there. What's kept you engaged, and, talk a little bit about, the different roles and positions that you've had there.
I've been very fortunate, and I do speak with new orientees to tell them about that there is a lot of opportunity in home care for a variety of nursing roles. So, everything from a field nurse, there's infusion, pediatrics, quality roles, and I've had an opportunity to function in a number of staff nurse roles as well as leadership roles. And now as president is really, it's pretty amazing to me that I've been able to have a career here at the VNA. And I think that for our people who are coming in or people who are looking for a chance to find a role in nursing that's very different and yet challenging, I think home health care is really a great place to be.
So parallel to your career, obviously medicine has changed quite a bit and nursing has changed, or even the therapy that happens in the homes. If you can, Give us a sense of what has changed, or your view of the changes in healthcare, and the beneficial change in terms of what is being done in the home versus when you may have first started your career as a VNA nurse.
Sure. I think that over time, just the advancements that we've seen in wound care, infusion therapy, the ability to take care of patients the same day that they had their surgery. So things have just progressed so much that we're able to impact people in a much broader way, where in the past, someone may be in a hospital for a stay of 5 days, and now they're home the same day or the day after. And we're able to really support the health system as a whole, and then to help our patients because people want to be home. And so for us to be able to provide that care, which is, like I mentioned, really it's complex and it's challenging, because you really have to be an expert in a lot of different types of conditions and insurance and all those different things. So it's a challenging job, but it's super rewarding.
So I know you're a nurse and you always will be a nurse, but I'm asking you to put your leader hat on here. So as the president of the VNA, when you tell people about your organization, what makes you most proud about the work that is done, or that the staff that you have, or the work that's done across the community?
Well, I think we our average daily census is 5,000 patients. So there's a lot of people in the community that we're able to keep at home instead of in a hospital or other setting. And I'm just proud of the high quality care that our staff provide. They have amazing teamwork. They really work well together across the various disciplines, and including our drivers who bring the medications out. There's just a wide variety of teamwork, and I'm really proud of all that, and really the fact that they make a huge difference in people's lives every single day. It's just I can't say enough about the team. They're just an amazing group of people who dedicate their lives to going into any number of communities, different types of homes, working together in order to make sure that our patients in the community can really stay at home. And they are impacting their own communities. So, we're out there, we're working in our own communities, and it's a great feeling to be able to do that, to help your neighbors and your family.
Yeah, that passion and that feeling for the work that is done and the staff that you have truly comes through in an interview like this. Lisa, appreciate your time. Thank you to you and all the staff at the VNA, touching upwards of 5,000 people every single day across 10 counties of Western New York. Thanks for joining us today here on Medically Speaking.
Thank you. Thanks so much, Mike. Take care.